I am Dr. Ansuman Mukhopadhyay. I am a respiratory physician and I work out of Kolkata. I am associated with the AMRI group of hospitals. This is a general hospital, and we have a respiratory medicine department which caters to the sleep aspects of medicine. Awareness of sleep is rising definitely among the general population, and we have more people falling into our clinics who report either sleep disordered breathing or sleeplessness, and they report to the respiratory physician, they report to the neurologist, sometimes to the psychiatrist with their problems, and they are more forthcoming with their sleep related issues. What most people realize is that uh, because of media information, information through their colleagues, friends, that sleep is an important aspect of their daily lives. And we spend about a third of our lives sleeping. I would say a little more than a third, because as children, as newborns, they sleep almost 22 hours a day, and the sleep time gradually comes down as we age. Adolescents would be complaining that their parents don't let them sleep because they would like to be sleeping more. And um, in fact, if you look at the whole time that we spend in sleep, it would be a little more than a third of our lives that we spend in bed and sleep. So it is important, and people realize the importance of sleep more and more. Now, before we go into what brings a patient of sleep to our clinics, uh, there are three types of sleep-related issues. One is sleeplessness. There is insomnia. People are sleeping less at night. They don't have any problem with their breathing mechanism during sleep. The second is a group of sleep disordered breathing. That means people who are snoring or who are having obstruction to their airflows while they are sleeping, and that causes a change in their sleep rhythm. They are having low oxygen levels, their sleep rhythm is altered. They may also be having cardiac dysrhythmias during this phase of time, and as a consequence of that, they never have a good quality of sleep. They have a non-refreshing sleep, and when they are awake, they tend to fall asleep. So this is excessive daytime sleepiness. You can have diseases which cause more sleepiness, like diseases like narcolepsy, where the person is more liable to fall asleep. And then you have parasomnias, like people who are walking around in sleep or talking excessively during sleep. Those are the parasomnias, or people with restless leg syndrome. So these are three categories of sleep-related problems that come to a physician. Uh, but whatever they are, it is finally uh, excessive sleepiness during their quote-unquote waking hours. And that sleep is important, and it has a tremendous economic impact. Has been proven many a times, because when a person is not sleeping well, the cognitive abilities of that person during their waking hours is impaired, the productivity is impaired, and there are a lot of accidents which have been attributed to sleep. For example, the Chernobyl disaster was attributed to sleep-related issues. The space shuttle disaster was attributed to sleep-related issues, and back home in India, the Bhopal gas tragedy was also attributed to sleep-related issues at the end of a work shift at night. So there have been serious accidents which have occurred, and about 20% of car accidents, car crashes, have been attributed to sleeplessness, which is not linked to alcohol. Alcohol will give rise to impairment in cognitive abilities, but apart from alcohol, about 20% of car crashes would also be attributed to sleeplessness or sleep-related issues. And for children also this is important. For children who are having sleep disordered breathing, or children who are not sleeping well, adolescents who are not sleeping well, their cognitive abilities also go down. And there have been reports, and there have been proofs of academic performance getting impaired because of these cognitive abilities being hampered. A patient with sleep disordered breathing, he would have changes in his, say he would have a pulmonary artery hypertension, which will, and a patient who is obese, who is smoking, has got a inherent lung condition, and he has a sleep disordered breathing. So that worsens his cardiac status, that worsens his oxygen levels, and these people have the impact of the comorbid illness is much more on these persons if they have a sleep disordered breathing or a sleep related problem. Cardiac issues are magnified because of sleep disordered breathing, especially cardiac rhythm disorders are magnified if there are sleep disordered breathing issues. And the incidence of stroke increases in people with sleep disordered breathing. Not that treatment of stroke will make a large impact to the incidence of stroke, but definitely sleep disordered breathing is an important comorbidity in patients who are having cardiovascular diseases, cerebrovascular diseases as in stroke. Now, awareness of sleep issues, although they are rising, but in a country of 130 crores, I think sleep takes a backseat. If we look at how many physicians ask the patient about sleep and how many patients spontaneously represent their complaints about sleep, if I take a random, there have been no very well organized surveys on this, but if I take a random perception among physicians, I would say most history taking will not include sleep as a routine part of that history taking. So we tend to ignore sleep unless it is self-reported. So that is a general perception among physicians. Also the fact that when as students, let me go back to our genesis and our development as physicians. As students, we are also not in medical schools that sleep is important. An undergraduate student is not having that awareness that sleep would impact various other diseases, and sleeplessness or sleep disordered breathing is important in a part of history taking and evaluation. It doesn't come to the forefront. So as a country, I think we are not that aware of sleep and its impact on our health. But yes, this should come in. This is a part of medical teaching, and I think it should be. It is improving. It is certainly improved since what it was when we were students. But I think a lot more awareness needs to go into it as physicians. As you know, there was a survey among American doctors, interns who were training to become specialists. It was found that doctors who are having more than one 24-hour shift in a 3-day time frame, and doctors who are having less than one 24-hour shift in a 3-day time frame, they compared the sleep patterns of these two sets of physicians, and it was found that the sleep pattern in the patients and those doctors who are having lesser number of sleepless nights were actually performing better. Their cognitive abilities while during sleep, the medical errors during their working hours were much less than those who were stressed and sleepless. So sleep is that important. There can be medical errors, there can be car crashes, there can be cognitive impairment. Workforce, for example, there are a lot of call centers in India which work throughout the night. And these people, during the day, if they are not sleeping well, it will impact their performance at night as well. So people who are working in altered shifts, altered sleep cycles, those who are forced to work in altered sleep cycles, definitely have problems in their work output as well. There has been no tangible data as to how much this loss of sleep impacts our economy, but advanced countries like USA, Japan, Canada, they have assessed, and it runs into hundreds of billions of dollars how this productivity affects their economy.